Hi to all watching. My name is Chloe and I'm going to present to you Chapter 1 for my community placement. My community placement was located at the Royal Melbourne Hospital, a major public hospital in Victoria. The focus was on outpatient services provided at the city campus. However, outpatient services are provided from the subacute campus also. This outpatient department is a major tertiary referral centre, providing statewide services to patients referred by their general practitioner or following an inpatient admission. The department has a hierarchical structure with multiple layers of leadership ranging from consultants to head of unit to head of department with CEO top of the chain. The department is located on level 1 of the hospital and has 4 different outpatient areas, from which many different specialist clinics run from each week. For example, the bariatric clinic runs from 1 South on Friday mornings. In order to provide specialised care, these clinics have their own specialist healthcare teams. These teams collaborate in a multidisciplinary way, with patients often seeing multiple different health professionals on the same day to improve convenience. This outpatient department is a very autonomous service with no major partnerships outside of the hospital. Hence, the major partnerships observed within this department are those between different health professionals. This occurs by means of multidisciplinary care and cross-referral of patients either within or between different outpatient clinics. There is a team of 9 dietitians who work across 10 specialist outpatient clinics. These dietitians are government funded in accordance with Tier 2 activity-based funding, and this influences the number of outpatient clinics that have a dietitian. Since many clinics only run for half a day each week, many dietitians have other roles, for example, as inpatient dietitians. They work independently in different outpatient clinics and do not have any formal meetings together. They do, however, meet up with their supervisors on a monthly basis and report to a dietitian who is a grade above them. The length of appointments varies depending on the clinic and patient complexity, with dietitians consulting both in person and via telehealth for outreach patients. These patients are able to access these dietetic services free of charge with a Medicare card, with the services accessibility only limited by the number of clinics and appointment times available each week. There is no specific directive at this hospital which dictates how outpatient dietitians must consult or what models of care they must follow besides DAA competency standards. However, most dietitians at this outpatient department practice client-centered care. This means they tailor their consultations to the needs of each individual and involve patients in decisions related to their own care. They also provide chronic disease self-management support by improving patient knowledge about their conditions and confidence to independently manage their conditions within the community by coordinating multidisciplinary care and ensuring regular patient follow-up. The purpose of this project was to evaluate the pre-existing outpatient dietetic services provided at the Royal Melbourne Hospital. This was deemed important to determine areas of patient care where dietitians were having the most positive impact on patient experience and outcomes, as well as areas for improvement. This involved attending all outpatient clinics over 4 weeks and disseminating a questionnaire to patients who have seen a dietitian. The questionnaire assessed the provision of client-centered care by evaluating whether care provided was tailored to the individual. It also determined how effectively dietitians were supporting chronic disease self-management, with questions related to improve patient confidence and knowledge to manage their conditions. This was, however, challenging due to renovations in the outpatient department, which meant dietetic clinics were being disrupted and some appointments cancelled. Additionally, a questionnaire was also disseminated to outpatient dietetic staff. This was used to identify dietitians who have engaged in professional development and to assess how this relates with patient-reported experience and outcomes. This was challenging, however, as it involved a lot of reminding to get the dietitians to complete the survey. Finally, failure to attend rates were also collected. This helped determine any trends between clinics that achieved better patient-reported outcomes and attendance rates. The dissemination of results and recommendations will relate to the communication theory, with consideration as to who, why, and through which communication medium results will be disseminated. As such, I will disseminate a formal report to project supervisors and subject coordinators. This will be detailed using academic language to demonstrate knowledge of the project management cycle and to provide a comprehensive summary of the results. I'll also provide a short 1-page summary and a quick presentation of key findings to outpatient dietitians. I will keep these concise as dietitians are time poor, with the purpose of showing what outpatient dietitians are doing well and to highlight areas and recommendations for improvement. Our side project involved the update of patient nutrition education materials, including the low FODMAP and cardiac rehabilitation resource. This was important as these resources were due for review and contained outdated information. These resources were updated in collaboration with the dietitians who distribute the resources and in accordance with evidence-based guidelines such as the Heart Foundation guidelines. Once updated, the resources were sent to dietitians for dissemination to patients. And that's a wrap on my placement experience. Thank you all for watching.